everybody, welcome back. My name is Brandy, and today I am here with Dr. Kathryn Heidt, founder of Foundations Functional Medicine. Today, we will be discussing the power of holistic healing through the use of a functional medicine approach. But first, to learn a little bit more about Dr. Heidt, a certified functional medicine practitioner, Dr. Heidt earned her master's in nutrition and went on to pursue a doctorate in chiropractic. With a solid platform in nutrition and metabolism, Dr. Heidt is a great example of a lifelong learner as she has continued her training over the years, studying further into immunology, endocrinology, hormones, fertility, advanced blood chemistry analysis, and much more. Her philosophy in her practice is that the body, given the right tools and with the right interferences removed, can learn to function optimally. She works to advocate that our bodies are always fighting for us, not against us. So it is our job to support the body's natural healing properties to achieve life-changing improvement. So to start off, I would love to learn a little bit more about what inspired you to get into functional medicine, and if you can explain for the audience what functional medicine is.
Yeah, so I think that functional medicine is really just a complementary approach to conventional healthcare, right? Conventional healthcare, we are so good at so many things, but we're not that great at managing chronic disease in a way that offers healing, right? It's usually that there's a medication introduced and then eventually maybe another one and another one. And so really the functional approach goes, okay, well, what if there's something way back that caused all this? And so really with that approach, we just try to determine where that root cause is, trace back, and then address that and help the body heal through those layers so that we don't need to just kind of manage with this medication and then this as it gets worse and worse. We want to help promote what makes the body heal itself, because the body truly is a self-healing organism. It's just got so many layers of burden on it over the years that, we're kind of trained to think, oh, well, you hit 30 years old or you hit 40 or 50. No wonder you feel bad. Everyone does. And it becomes kind of this normal thought, like menopause, you just kind of expect that, well, when I hit menopause, it's going to be miserable because it was for my mom, my aunt, my sister, my friend, all of the above. And so that really, that's a good example of that separation of what's normal versus what's common. And so kind of confusing those two things, we need to be able to tease that back apart and say, hey, no, it's not normal for your body to suffer and suffer and suffer through your years. You should be able to thrive and live well. Doesn't mean things aren't going to happen, but we want to trace back ultimately to that root cause or the root causes that led to the dysfunction that led to the disease. So that's really the functional approach. For me personally, and I think this is probably the case for the majority of people that, go through sell their soul to try to get to the degrees that they have the platform to understand a lot of how the body is connected. I think it comes from a place of our own personal struggles. And so that was the case for me. I grew up with asthma. I grew up with allergies. I grew up with eczema and a lot of skin things like that, I just thought, well, my dad's got all that. So that's, it's genetic, right? It's genetic. And then I had a medical doctor challenge that to me when I was about 13 years old. I'd broken out in a rash. I was discovering a peanut allergy, full blown, and I was like, what is this? So he came in, he did a house call, and he came in and said, how much are you willing to do to fix this? And I was 13 years old. As a girl, I was wearing long sleeves through the summer. I was going anything. And he just kind of lowered his glasses and he goes, be careful what you ask for. And so he gave me a dietary plan. He said, I don't care what else you eat, but I need you eating this many vegetables, this many fruits, this much fiber in a day. If you're still hungry, eat what you want. And so I kind of rolled my eyes, but I truly was willing to do anything, right? And so I started doing that. And within a couple of weeks, my skin was doing a lot better. And I had this rash that I didn't know what came from for like 6 months. So that was very eye-opening to me that all I did was add things into my diet that started to help my body heal. And so with that, and then going through, Brandy, was I frozen or are we good to go?
You're not frozen. Maybe take a step back and then continue. Okay.
So really the dietary approaches, that the things that I added in and being able to see how that helped my body heal was very eye-opening at a very young age. And then my family shortly after that adopted a little boy, and we started to realize he had some special needs and things like that. And so my mom was doing research and she was like, we're going to start eating raw garlic and we're going to start doing this and no more food coloring and all this kind of stuff. And I was like, she's crazy. She's nuts. So really my teenage years, seeing my mom do that, seeing it work for me, really was just very eye-opening. And so I knew that there was more to this. And from a young age, I wanted to be a doctor. And so it just kind of morphed into, okay, well, this is the kind of doctor I want to be, teaching people how to keep their bodies and get their bodies well. So there's the backdrop on all that.
I love that explanation. I love that you brought up too, because I think it's a common misconception that all of these conditions that we have are genetic, when oftentimes it does have to do with those environmental factors. I know for me, the main factor for me has been chronic Lyme disease. Having Lyme disease and having it untreated is what has caused much of what I've gone through. And learning that it's not necessarily genetics every single time. And when you can find those underlying cause, then you can make changes about it. I love that you made a statement to that, because that's so important.
Absolutely. Yeah.
Okay, well, before we continue, I just want to absolutely shout out your Instagram, because you post videos on there, you post informational content. I know for somebody like me, being able to scroll through and see that day by day, it just really feels like it offers me that sort of highlight each day. But I'm going to shout you out at the end, make sure I tag you so that other people can find this. Anyways, on your Instagram, I saw you focus a lot on misconceptions about birth control and PMS symptoms. Can you discuss some of those misconceptions and what alternative treatments you suggest for patients with those concerns?
Yeah, so the biggest thing here, and I want to be careful because, in the past, I wouldn't have had this sort of disclaimer that I'm not anti-birth control, just because I take a step back and introduce some questions. And so my goal with discussing birth control on Instagram or with my patients or here in this realm is really just to advocate for informed consent. Because most women who take birth control, they're almost prescribed it as a first option to treat PMS or heavy periods, which that's a misconception there. So I'll circle back to that. But a lot of times in a lot of and I ask a lot of questions about this in my intake forms because I need to know where it originated and why. And a lot of times it's simply, well, I turned 13 and my doctor told my mom I needed it. And to me, that's just not good enough because one, your whole teenage years are very, very important for your hormones as they kind of figure themselves out. And sure, there's going to be some acne, maybe some things like that, which, by the way, usually goes back to the gut. And so we're mistreating, I believe, I firmly believe this, that we're mistreating with birth control. And so now, here's the part of that I want to say very carefully. Birth control is a powerful tool. As long as women understand the informed consent part of this, the impact on the body, potential risks, all this kind of stuff, and feel confident that it's still the right choice for them, power to you. I'm grateful that we have that as an option. I'm a working woman. I don't want a child. If that was something that I wanted and or needed, now there are alternative ways, but if that was something that I needed, I'm grateful for that as an opportunity, right? So we just have to find that balance of it's not anti this or that. It's simply, well, if you're being provided this for the misconception of that it's going to fix or treat your PMS, all it's doing is slapping a big giant Band-Aid on it with a little bit of numbing cream. So a lot of times, and not all the time, right? You hear the horror stories of birth control making a lot of these women worse, but a lot of times it can help control heavy periods because a lot of times it takes away the period completely. And or if you are cycling, it's not a period, it's a breakthrough bleed. And there's a distinct difference there. So your body is not having the opportunity to cleanse itself essentially once a month and shed that uterine lining. And so it may decrease the heaviness of bleeding and it may decrease some of the cramping and it may even help with some migraines and things like that. But it's a Band-Aid. And that's just the kind of going back to that first question of the functional approach is to say, man, but those problems are there because of something that was going on in the gut. If we mask that for the next 10 years, oh Lord, that problem is still able to progress. And so once we rip that Band-Aid off, that problem is right back. And that's what a lot of these women find is that, all right, I tried birth control for a little bit. And when they come off, they have to go right back on it because the problem comes right back with a vengeance. And so that's what a lot of my birth control discussion is all about, is just to say, hey, are you on that for the right reasons that are your reasons, or are we masking symptoms? Because that's a misconception. Birth control doesn't fix anything. It just masks the symptoms. Mm-hmm. It's probably the biggest misconception I would speak to on that one.
I think that's a great way of putting it. I think that's one of the things that a lot of people don't think about with birth control because it is so normalized these days to try birth control.
Yeah.
All right. Well, switching gears here, personally, as somebody who comes from a family with a history of thyroid disease, your content around conditions such as Hashimoto's, hypothyroidism, and hyperthyroidism really sparked my interest. For many years, my sister had all the classic signs of hypothyroidism. She had hair loss, weight fluctuations, fatigue, brain fog, heat intolerance, and mood changes. But doctor after doctor would tell her that she had nothing wrong with her because her blood test kept coming back normal. The only time in which somebody actually questioned it was when they did an ultrasound of her thyroid and they found nodules. And then they looked into it and they found that she had Hashimoto's.
Mm-hmm.
For some of those people out there, what would you say are some of the common myths about thyroid disease? And how would you suggest those experiencing similar symptoms look deeper into their health if they do have a similar occurrence like this, where their blood work comes back looking normal?
So when the blood work comes back looking normal, sorry to use so many quotations, but when the blood work comes back looking normal, it's not a thyroid panel. If there is a thyroid problem, often what we see that is run is just a TSH, which is a brain hormone. Okay. Now, TSH, I rarely see that is actually reflective of thyroid production because we have so many things, which chronic stress or chronic low-grade infections are two major causes of a disrupted brain to endocrine system, brain to hormone, brain to thyroid imbalance. So if we have this disconnect almost with the brain, which can also be caused from chemicals in our environment, phthalates, parabens, things like that can disrupt how the brain communicates to the thyroid, but the brain is what has to initiate that thyroid production activity. It's like the brain has to ask for enough thyroid hormone to be produced, okay? Now, not only that, but once enough is produced, let's say all that looks good. Those are the two most common things tested for in a thyroid panel. If they go beyond a TSH, it's usually just the T4, which is just what the thyroid is doing. However, that's an inactive hormone. It has to get activated to T3, which happens largely in the gut and the liver. I see a lot of gut and liver issues in almost every single patient. So people, especially women, we've kind of made this a faux pas to talk about our bowels and our gut and things like that. And I just want to bust open those doors and say, hey, trust me, it's just about everyone. Look left and right. They're hiding things. So if we have so many gut issues and detoxification issues, things like that in the liver, that's where a lot of functional hypothyroid comes from, meaning that your thyroid can be doing just fine. In fact, a lot of times the thyroid is doing just fine, but it's not converting to that activated hormone. Now, to bring up the Hashimoto's side of that, Hashimoto's is an autoimmune reason for hypothyroidism, and it's the number one cause of hypothyroidism. I'm going to blame the insurance system. Okay. The way that insurance is set up does not test for Hashimoto's because truthfully, a lot of the purpose of an insurance covered lab test is for then the medication outcome. It's a process. It just is the way it is. Medicine is more and more corporate. Okay. It's more and more of a business. And we have to just recognize that. And it's not an evil thing. All right. Some people, stigmatize it that way, but really we just need to look at it for the flaws that exist. Because if we're only able to test that TSH, because insurance only covers that, we're missing 95% of the rest of what could be going on with the thyroid. And so unfortunately, that's where a lot of patients get tied up, especially if they don't look necessarily hypothyroid. If they don't quite fit the bill of a 45-year-old female who's gaining some weight, maybe a little bit of hair loss, all this kind of stuff, maybe they'll have a deeper testing of the thyroid. But by and large, I find hypothyroidism in my 20-year-old patient, in my 32-year-old patient, in my gut patient, in whoever it may be. I find it almost left and right. I find it quite often, at least some degree of that. And so I think it just is a matter of being able to dig a little bit deeper, which unfortunately does go outside of the insurance realm sometimes. And that's also a barrier for some people. And so we try to work around that as best we can. But, being able to focus in on that, I'm able to see how common Hashimoto's really is. I test it on every single patient that comes through my door. And at cost, it's a $14 part of the lab. That usually doesn't break the bank. So we can screen for it. We may as well. And so I do that. And I find it so often So it's being the number one cause of hypothyroidism to me, no brainer. Let's test it on everyone who has even one symptom of hypothyroidism. That's my perspective on that.
Interesting. Okay, so what would you suggest to those out there who are struggling when they're going to their doctors? What would you tell them to ask their doctors to test for?
I love to see a TSH, a free and total T4, a free and total T3, a reverse T3, a T3 uptake, and then the two most common antibodies against the thyroid for Hashimoto's. So there's 7, and you can run even more. A lot of times, even when I suggest that that is what's requested, maybe about half of that is done. So ultimately, what I want to say is just find a functional provider who will do it without question, because here's also the thing. If you beg and really just ask and advocate for yourself, which is great, to your primary care, and they don't run it anyways, it's not necessarily something they are equipped to interpret, right? It's like asking someone to run something that they don't do. So what do they do with the data, right? So I do encourage people to find a functional provider who actually runs those tests already, because they use the information and know how to interpret those results.
That makes a lot of sense. And I'm sure it's different for everybody, because I've heard, there's a normal range, but then there's that optimal range for a lot of people. And from a functional medicine perspective, I feel like the functional medicine doctors I've had the pleasure of talking with really look for that optimal range, where should they be?
Yeah,
and so I think that helps even further for them to interpret. But yeah, I never even thought about that. If they don't know how to interpret it, that's not going to be much help to you. Okay. Yeah. All right. Well, I love how you bring a light into the importance of our liver and our detox pathways and our gut, as we've talked about, especially when we consider all of the toxins that we're exposed to on a daily basis. What are some of the top things that we can do to help decrease the toxins that we allow into our bodies?
So I'll speak mostly to women here, because one of probably the first big category is the stuff that we lather on our bodies, right? From makeup to deodorants to perfumes to hair stuff to lotions. I mean, since we were a cognizant little girl, we've seen the commercials, right? Anti-wrinkle, anti-aging creams. You need the masks, you need this, that, and the other. I remember being a young girl thinking that I couldn't possibly shave my legs without this shaving cream, and it was the pink stuff and then I wanted to try Nair and all this stuff that is just loaded with these chemicals that are foreign to our body. And so, a lot of people say, well, there may not be a research study that shows that this amount of that chemical does anything. Well, I have 2 points for that. One, foreign is foreign. If the body is introduced to new substances, it could be a pathogen. It doesn't know. So it treats things as if it shouldn't make it into the body, which creates inflammation and can promote autoimmunity. Okay, so there's one thing right there. The 2 is that a lot of our studies that may not show direct harm don't include bioaccumulation as a factor. So we are constantly, think about how often, we put on makeup. Some women wear makeup every day, some women reapply it every, halfway through the day. Lotions, deodorant every day, reapplying, it's bioaccumulating, meaning that as our bodies are exposed to it, we absorb it or inhale it or whatever it is. And sure, our bodies are equipped to get rid of that stuff, the liver, the gallbladder, the gut, the kidneys. We detox it, we get it out. Oh my gosh, there's more. Oh wait, there's more. Okay, we're detoxing, there's more. So it accumulates over time. We're talking decades and decades. And so there's so many things that we just need to control for with our products. So women in our products need to be low toxin or non-toxic products. I personally love the company doTERRA. I use all my shampoo, my soaps. I make, my own face stuff with their products. So that's one way that I help my patients and myself avoid some of those toxins. The other big area are plastics. Okay. And one of the easiest switches, get rid of the Tupperware. And if you don't want to get rid of it, at least don't microwave anything in it. Okay. When we microwave and add heat to plastics, they leach these plastics into our foods, into our liquids, and then those get into the body. And then just generally speaking, promoting detoxification. So we step outside, right, and take a breath of fresh air. And unless you're in like, nowhere land, Montana or Alaska, it's not really fresh air. You're getting exhaust and all that. I mean, I step outside and they're doing road work down the road near my house. And I'm like, oh, nice, fresh breeze in the morning, So we're constantly getting things into our bodies. So the third category is really just diffuse. It's everywhere. It really is. And so I really would just say kind of lean in towards supporting the way that the body gets rid of that. Exercise, sweat, eat your vegetables, fibers, stay hydrated, things like that. Just very simple things can support in ways that help your body detox those chemicals.
That's wonderful. I know a few that I've encountered recently because I love how you talked about the plastics too. I was looking at my pantry just recently and I was just shocked at how many things come in plastic Tupperwares too, and so then you're storing it like that. And then that started to make me think like, oh, wow, and so now I'm trying to make that transition currently of, trying to avoid anything that comes in plastic and trying to find anything that I can just put in a bag, bring with me, vegetables, things like that. But there's so much that we get in the grocery stores now that it just, you don't think about it.
It already comes that way, yeah. Like carrots are pre-bagged, or you can find the free bundled one. I usually tell people when they go to the grocery aisle with the fresh produce, don't grab the bags, grab the stuff that looks like it was plucked out of the earth, wash it off, and then don't bag it. Don't put it back in plastic, One of the big things for me is mason jars. I have mason jars throughout the house. It's glass, just replacing even what you're drinking your water from into glass or stainless steel, things like that. And it can be overwhelming for people if they think, oh my gosh, I have plastic everywhere. Everything is that way. Don't worry about tackling it all at once. Create a plan of action, give yourself 3 or 6 months to kind of replace these things. Make it a journey, make it fun. It doesn't have to be, oh my gosh, stress, I have to do this by tomorrow. Hey, you've already been accumulating these things for how many years by now? Another 6 months isn't going to break you. So slowly start working towards those goals and make it achievable and not overwhelming, because you add stress into all that. And it's like, okay, now you're really revving up the negative impact of that just with stress. So no stress, stress-free, make it fun, make it educational with the family, and then just make it happen over time.
That's a great point. I think a lot of people, especially things with like diets, they want to jump into it and then you become so discouraged. But when you take the baby steps, that certainly makes it a lot easier.
Yeah.
Well, with how normalized certain symptoms are nowadays, like PMS symptoms, gut discomfort, and even mental illnesses, what are some of the common overlooked symptoms that could be an early sign that someone should take a deeper look into their health?
Gosh, sleep disturbances, someone who either has difficulty falling asleep or wakes up throughout the night, waking up not feeling rested, getting energy by the end of the day as opposed to starting. Our bodies exist on rhythms. They really do. And so anything that falls outside of that rhythm, something's off. It's called your circadian rhythm is what I'm talking about. That is one of the easiest ways for you to assess your overall health. Another thing, I'm a big fan of the Oura ring. I think the Apple Watch can give you some of this information too. I prefer a ring, but HRV, resting heart rate, things like that are really good, simple ways to just get some insight into your health. I've had patients buy the Oura ring and, wait for a couple of weeks for their data to normalize and go, oh my gosh, my HRV is a 12. I'm going, yeah, it should be at least a 60, so we got some work to do. So there's little things like that can just tell you overall where you can work on some things. But sleep disturbance is one of those early signs. Fatigue is another thing. People should have energy to get through the day. There were some things that came up in my personal health over the last year, and fatigue was one of the first things that kind of lit a light bulb on for me going, uh-oh, why am I tired? It's 3 o'clock. I don't need caffeine. What's going on here? So that was a red flag indicator that, again, back to early in this conversation, a lot of people take these early signs as normal because they're so common. So if anything doesn't feel right, really, this can be bloating. It can be blurriness to the eyes. It can be a little headache that just kind of nags you. And any little thing, that's your body telling you, hey, something's not right now. Please do something to support me before things go really wrong, before we blow past that threshold, and then we really have symptoms, and then you can actually look for a disease diagnosis at that time. Our body's telling us what's going on. It's telling us what's up long before we have a diagnostic level.
I find it interesting because so many things are normalized. And even when we talk about caffeine, so many people nowadays, they'll tell you, it's like a quote now, don't talk to me before I have my coffee. And, they're speaking to that fatigue and they're speaking to that sleep deprivation. And we don't question it because we're like, oh, but everybody does this. Where I think I love that you bring that up, because I think that's a great point. Just because it's normal doesn't mean that it's the healthiest way for us to be living, just as it doesn't mean that it's the optimal way for us to be living. And so kind of questioning those normal symptoms, those normal habits ultimately are going to help so many people. I know for me too, fatigue was one of the first ones. And I'm sure that's because my body was working harder than I knew it was. And so you're pushing your body much harder than it should be.
Yeah, that's a really good point, that when the body is trying to deal with these things, our conscious perception is so small, right? But the rest of our body, the subconscious part of our brain, the rest of it is on overdrive. And this is where I see a lot of anxiety, where, and the way I explain anxiety is to say, hey, it's not for nothing. You feel like, oh my gosh, what do I need to do? What needs to happen? I'm anxious. That's your body telling you something's going on. It's running on overtime, sending all these signals, these excitatory signals to your conscious brain. And all your conscious brain thinks is something out here, right? Mm-hmm. As opposed to something in the body that needs to be addressed. Our anxiety is like focused externally, or, looking forward, or social, or whatever it may be, when in reality, it's an internal thing. And this isn't everyone, but this is almost every case of anxiety that I see, where we just need to calm down what those major signals are, because the body is trying to tell you. And once people become in tune to that, man, there's a really cool transition from working with someone who has no idea why they're anxious to then realizing, oh, I'm only anxious now right before my period. Bingo, we can dial into that. Or I'm only anxious now, when this happens. Bingo, we can dial into that. So being able to kind of narrow down their own intuitive feeling of what that anxiety may be coming from. It's really cool to see that. And usually patients tell me about 2 to 3 months in, and I'm like, there we go. That's the next direction. Let's tackle it. And so the biggest part of what I do, my favorite part, is watching people and listening to people as they become more body aware. Then they guide their own plan of care. They pretty much tell me what's going on, because their body is now telling them, because they've calmed things down enough to be able to communicate that. It's really cool. It's really rewarding for them and for me to be able to see that.
Yeah, I think that's such a wonderful skill set too, that we all should be equipped with, is, understanding how to listen to our bodies. I know a friend of mine told me, he was like, anytime I eat this specific food, I start to feel depressed afterwards. And being able to make that connection, now he's able to treat his depression from a whole different perspective, and able to sort of navigate his life around those triggers that he finds. And so in a way, I feel like it's so important for us to journal so many of those normal health habits that we go through, and how each of these things affect us. I know for me, one of the weird ones I found was that the weather changes affect me drastically. And being able to know that now, if I start feeling off, the first thing I do is I look at my phone and I look, is there a storm coming? Because I know that's one of my triggers. And if so, then I can do what I need to do to take care of my body during that period of time. So ultimately, it's become super beneficial for me to mitigate my symptoms on an even deeper level that anybody can do. And it's so easy to do once you take those first steps. So thank you. I love that you brought that up. Okay. What are some of the top habits you believe we should all work on doing in our everyday lives to start making those improvements to our health, other than what we just kind of talked about with like health journaling and keeping an eye on that sort of mindfulness with the body?
There are so many directions I could go with that. And I really just want to boil it down to that internal narrative. Self-kindness, I think, is something that's forgotten. Even if someone is not necessarily overly critical of themselves, are you overly positive of yourself? There's a lot to be said about the self-healing aspect of what thoughts we ruminate on. The body becomes aware of what thoughts constantly go through the mind, right? The best analogy with that is, think about if you're car shopping and you've been looking at that red red Jeep, and you don't see red Jeeps very often, but you're searching for one. And so now you start seeing it everywhere. You're on the interstate, you're on the back roads, red Jeep, because you had that thought going through your head over and over again. You're now making those neural connections to be aware of. So if you're not focusing on the things that promote your health, promote your healing, it could be simple little mantras of, telling yourself, I give you permission, I give you space to heal, telling yourself that. Focusing on those thoughts as opposed to, oh, why did I do that? Why did I say that? That was dumb. I probably looked stupid. Did my eyebrow, curl up too much for that photo? Like little things that we ruminate on against ourselves as opposed to for ourselves. And just like the recognition of that red Jeep driving down the road, your brain is going to start recognizing those negative patterns. Because here's the thing, emotions and thoughts that we feel, they're very connected to physical substances, neurotransmitters, hormones in the body. What's a physical substance do? It has a physical impact. And so again, there's so many directions we could take with this, eat your vegetables, stay hydrated, make sure you're having a bowel movement a day, most days of the, all that kind of stuff. But I think that a really big underrated aspect of health and healing that anyone can do for free today is to just stop, take a deep breath, repeat a couple of positive statements to yourself throughout the day. Don't let these negative things build up that you ruminate on, but choose healing, choose it, and then promote it in your internal psychological narrative. And man, that's the stuff that changes lives for seriously. And I missed this earlier in my career. And I focus more on that now more and more because I see the success more and more, people who are willing to truly do that.
It makes a lot of sense. You got to have motivation to take those steps to feel better. And so you got to start there. That makes a lot of sense. All right. Okay. What would you say to those who may be watching, who have been told that their symptoms are all in their head or that medication is their only option for treatment? Where would you tell them to start?
I would say just reach out to a functional provider near you. If you're in the Carolinas, hi, I would love to speak with you. But I just reach out to a functional provider, because if you feel that there is something off, and speaking of my Instagram, I get messages on Instagram almost daily of, someone just venting their health history to me, which I can't respond to on, to their, what do I do about this? I can't respond to that, but it's eye-opening to me because it always comes with the fact of, I've had testing, I've gone to this doctor, I did this, they tell me everything's fine. Someone wants to give me this, psychological medication and I'm depressed or whatever. But I have these symptoms, and they're very clear symptoms of maybe PCOS or estrogen dominance or IBS that's because of bacterial imbalances or hypothyroidism. And so I just want to tell people, if you have symptoms, that is your body's check engine light. I don't care. Even if I have a woman come in and her labs actually look good, this happens once in a while. Someone who feels terrible, they come to me and their labs, even optimally, even functionally, look fine. There's still something going on. Okay, because the body is really good at compensating, the body can compensate and make, kind of blind providers into thinking, well, the data's fine, she must be fine. Absolutely not. That's where the art of functional medicine comes in. It's not just about the science, the numbers. It's a bit of the art behind that of going, okay, let's take a step back and think about this. So find someone who's willing to advocate and be a teammate with you, as opposed to just visit to visit, things look fine. Sorry, you don't feel well, talk to your support group. They don't feel well either, but they're fine as well. I think that you just got to find someone who's who's driven to be a teammate, a team player with you to discovering that cause.
Well, it sounds like do that extra detective work to really search the underlying cause too.
Absolutely. Yep. In a nutshell, perfectly said.
Okay, well, I have one final question for you. Is there anything else that you would like to say out to those out there who may be struggling to hold on to hope that they will be able to find healing for whatever they're going through?
You're not alone. And this is actually a whole direction I'm hoping to take my business in the future by this coming year, is community groups. Because healing occurs in community. It occurs when you don't feel isolated and alone. And a lot of people need that one-on-one care, sure, but a lot of people just need to know that they're not suffering alone. There are other people that experience the things that they are. So I think in order to keep that hope, You're not alone, and we can learn. I can learn, you can learn, we can all learn so much from each other. And, I've got some book smarts behind me, sure. I've got some patient experience, sure, but I learn every single day from my patients. So I think that, and I'll learn something from this patient and mention it to this patient, say, hey, this may be something you'd want to try. And then it works for them. And lo and behold, this person through me helped them, So I think just knowing that you're not alone, trying to find that connectedness. And I think functional medicine as a whole needs to go more in the direction, which it does in a good bit, but more in the direction of these community-minded healing projects, so to speak, that people can build off of each other and have that support, neighbor to neighbor. I'm not going into your home and telling you what to eat and what not to eat, right? But hey, if your neighbor and you are both trying to avoid gluten, let's make it easier. You make the casserole tonight, you make the, what I mean? It's easier when there's people around you helping make it fun because they have similar goals. So don't feel isolated. I don't care what you're going through. I don't care what weird little symptom you have that you think is only yours. It's not. All right. There are other people out there experiencing it. Trust me. And we just need to remember that we're never alone in our process.
I think that's amazing. I love that you're trying to start up community groups, because I know that's something that throughout my healing journey, finding community groups with people who have gone through similar things has been so impactful, not only just to find options for recovery, but just to know that I'm not alone with all of those symptoms. So thank you. I want to thank you again so much for taking the time to be here with me today. Everything that you said is so informational, and I really think this is going to help a lot of people. Would you like to shout out your website and your Instagram for anybody who would like to follow you?
Yeah, so the Instagram is dr_Heidt, so Dr. Heidt. My business website is kind of going a 2.0 right now, speaking of, the new direction. So I've got my website under construction. So there's a bit of a landing page to it now. So if it looks, like a landing page, it is right now. But it's drkathrynheidt.com, drkathrynheidt.com. I keep things pretty simple. Heidt is Heidt. Yeah, I have a lot of people reach out on Instagram, and some people reach out through the website. Either way is great. I usually refer to my email after that. So I'd love to hear from anyone who is looking to get started on their journey.
Wonderful. Yep, definitely check her out. Like I said, I follow her. I've already learned so much in the last couple of weeks I've been following her. So a lot of great information on there. Thank you all so much for tuning in. And if you'd like to see more health content like this, you can follow me at Finding Your Internal Symphony on Instagram and on YouTube. I hope you're able to learn something today. I know I did. And once again, thank you so much for watching. Bye.